All right, so with the first confirmed case of coronavirus in the country, South Africans have been encouraged to take precautionary measures, and one of those is washing your hands properly. Experts say that washing your hands is a key part of preventing the spread of viruses such as the coronavirus. We are advised to wash our hands frequently. We speak to Dr. Kgosi Letlape, who joins me in studio. He's a member of the Global Hygiene Council. Good afternoon to you, Doc. Thank you so much for coming through.
Good afternoon, and thank you for inviting me.
All right, so you've got cynics really who ask if washing hands could really prevent the spread of diseases.
That's been proven scientifically.
Yeah.
And in hospitals or facilities where hand hygiene is practiced properly, the rates of infection have been dropped below 90%. So it's the simplest procedure, but it's probably the most effective procedure in terms of curbing the spread of infectious diseases.
All right, so as I said in my introduction, we've been advised to take precautionary measures and wash our hands properly and frequently. What's the most effective way of washing one's hands? I know it sounds like a simple question, but a very important one.
The first thing, you need soap and water, running water in particular. And I think if you look at your hands, look at the parts of the hands that you have. You have the palms, you have the back, you have the spaces between the fingers, you have your thumb area, you've got your wrist area, and you've got your finger beds and your nails. And those are the areas that you need to cover. So you just look at the anatomy and you can have a sequence of covering those areas. Rub your palms together, rub the back, then you get into the palms of your hands, you get into the wrist areas, and you go around your thumb and you rinse properly. So effectively, as has been said, if you sing happy birthday twice, you should have spent enough time to wash your hands. It's not about putting your hands under running water and dipping them. You got to rub, you got to use soap, and you got to have running water to rinse your hands.
You talk about running water. I just want to focus a bit on that, because can I also wash it in a bowl, or does it have to be under a running water?
If you're the only person using the bowl, that is fine.
Okay.
But it would be much better if you have running water. You'll see sometimes you have people sitting around and a bowl is being brought around. If the person in the bowl uses it to spill over your hands, over your open hands, they're creating running water for every person. That would be ideal. And that's what we need to be aiming for.
All right. So you made mention of research at the beginning of our conversation. I just want you to sort of touch a bit on what research says, scientific research, when it comes to washing hands and perhaps preventing infections and viruses such as coronavirus. Talk to us a bit about what research says.
Well, what the research has done is to show that when you wash hands, you reduce the number of contaminants on your hands. You can swab hands and culture them and be able to know the type of organisms we have on our hands and the numbers. And when you wash hands properly, you drastically reduce that number. But more importantly, in terms of what the research has done in terms of hygiene, is that whatever germs you have on your hands, you can transfer to surfaces. So it's also important to have the habits of cleaning surfaces regularly that we touch, that are for common use. You know, the remote, the handles of the doors, the handle of the fridge, all those common areas where many of us touch need to be cleaned properly and cleaned with proper disinfectants.
Yeah, I think I was reading a report really where some scientists are arguing that 80% of diseases can actually be prevented by washing your hands properly.
Oh yes, billions and billions of dollars or rands, depending on your denomination, will be saved by the simple practice of washing hands. And remember, when we're talking about respiratory illnesses and coronavirus, there are other basic hygiene principles that need to be taken into account. So it's not just the issue of washing hands. A proper cough etiquette becomes important in terms of curbing the spread of the disease. Either cough into a tissue if you have one. If you have nothing, cough into the elbow. Nobody goes shaking elbows with somebody else. So a proper cough etiquette becomes important. Having tissues with you becomes an important thing. Having your own small bottle of personal hand sanitizer becomes important to have, because those solutions have are alcohol-based and are extremely effective in disinfecting our hands.
Yeah. Talking about sanitizers, we always say that hands should be washed with soap. How effective are sanitizers? Because a lot of parents here at work have been saying that their children at school have been advised to bring bottles of sanitizers. So does it have the same effect as washing your hands with soap?
The sanitizers are extremely effective. If
Proper sanitizers, you said to me.
Yes, if you not homemade concoctions. If you go into most health institutions, you will see that most of our institutions have instituted simple measures where as you enter the hospital, there's a sanitizer that dispenses. If you enter a ward, there'll be sanitizers. If you enter high-risk areas like high care, ICU, not only are you expected to have sanitizers, they take your sleeves up, you wash properly, you have sanitizers, you'd even have protective clothing. So this is a simple measure that is extremely effective.
Yeah.
So we need to ensure that not only do we carry one personally, but in public places, they are readily available for the people and the public to access.
Yeah, we even have that at supermarkets. Before taking up a trolley, there is a sanitizer and wet wipes for you to wipe off the trolley before using it.
All those measures are extremely important. And that should be habit. That should be part of how we conduct ourselves. And I think it's probably good for us that we have this challenge before our flu season, so that we can all improve our hygiene habits. With the SARS epidemic in the mid-2000s, what happened was, because the SARS epidemic came from the Far East, on the subsequent season, when their hygiene habits had been heightened, the incidence of influenza was much, much lower than they had experienced. So if we made good hygiene habits part of what we do under normal circumstances, it would prevent us, it would curb the spread of infection.
And I suppose we're still lacking on that front, because that National Hand Hygiene Behavior Strategy had actually estimated that only 20% of South Africans washed their hands with soap at critical times, such as before, during and after preparing food and after going to the toilet. So it looks like as South Africans, really, we haven't really made it a habit to wash our hands regularly.
Yeah, I think part of the issue, I hope with the school program, they keep repeating it to young children that washing of hands is important. And it's also important that when you talk about sanitizers, bring them to school, the children will now ask at home, why don't we have that opportunity? Because sometimes you don't always have the opportunity to go to where there's running water. So it's important that these opportunities present themselves. And I think given the fact that we've had one case in South Africa, all of us should be aiming at doubling the number of times we wash our hands daily. If you're not washing your hands more than 6 to 10 times, you're not doing a good job.
Okay, so one has to wash their hands 6 to 10 times daily?
A minimum. Yeah. Most of us use the bathroom a couple of times a day. Most of us eat meals 3 times a day. So if you go into the habit of just washing when you go to, before you use after you use the toilet, before and after you prepare or have food, that you'd have at least 10 opportunities a day to do that.
All right, so from what I'm picking up from this discussion is that you say that if we're doing the correct things, really there is no need to panic.
There's no need to panic. And I think we should be thankful that we have a National Health Ministry that has prepared adequately and is doing all it can to educate us. But this has to be a collective responsibility. It has to be each one teach one. And there'll be other things where the community leaders have to come to the party. The issue of public gatherings, big congregations, funerals, weddings, we've got to be more careful. So people that organize those events must be able to afford greater opportunities for people to wash their hands. So we should make it a habit. If we're going to invite people to a feast, to a wedding, we should ensure that there's ample opportunities for proper hand washing or use of sanitizers. Not the issue of the big bowl after the funeral and all of us dip our hands into the same thing.
Yeah.
That should be discouraged. That should be discouraged, and we should come up with proper hand washing habits.
Is it advisable now for one to take immune boosters? Because at one of the shops here, they're running out of immune boosters, they're running out of face masks as well as sanitizers. So I think people are starting to panic now.
Yeah, people are panicking.
Yeah.
And they are wasting money. The issue of immune boosters, it's you got more money than brains, and that's fine. Spend it. Masks, you're panicking. Mm-hmm. And we don't want to create a crisis where there are not enough masks. If you look at how the common flu is transmitted, which is the way coronavirus is transmitted, it's through droplet infection. So it is not airborne. It is not in the air. It is in the particles that come out when an infected person coughs.
Yeah.
Those droplets, if you are close, so social distancing becomes important. If I cough and I'm infected, anybody that's within 1.5 meters,
they will get it.
Will get it.
Yeah.
Will get the droplets. Okay, so social distancing becomes important. The issue of a mask would be important for masks to be available to infected people. Not masks to be available for people that are trying to prevent infection. Because you could have a mask, but if you forget about hand washing, if you forget about surfaces, you're going to touch a surface and you're going to touch your eyes where you have not blinded the eyes, there's no mask there. So it becomes a false sense of protection. So let's leave the masks where it is appropriate, particularly for the infected or for the people that are caring for infected patients. And for all of us in the general population, just basic hygiene, hand washing,
wash your hands,
becomes critical, and all of us should be able to do that.
I wish we had more time on this, but we have to leave it at this. Thank you so much for coming through, Raleboga.
Yeah, thank you for inviting me.
All right, well, there you have it. Dr. Kgosi Letlape is a member of the Global Hygiene Council, talking to us about the importance really of washing your hands. Let's now take a quick break. We'll see you right at the top of the hour when we begin the second hour of SA Today. Stay with us.